Medtronic technologies impacted more than 72 million people in the last year, equating to 2 people every second. Harnessing the power of technology to take healthcare further, each technology has unique benefits designed to serve patients. The goal of this program is to get closer to the patient and to delve into the challenges and impact each technology has in practice. This is the Medtronic MedEd learning experience. The BIS monitoring system should not be used as the sole basis for diagnosis or therapy and is intended only as an adjunct in patient assessment. Reliance on BIS system alone for intraoperative anesthetic management is not recommended. Medtronic's medical education programs are offered to provide attendees education on the FDA-cleared indications and use of our products when applicable. The contents and conclusions of the following program are solely those of the speakers unless otherwise cited. The speakers are responsible for all content and any necessary permissions. The speakers received funding from Covidien LP, a Medtronic company, for the speaking engagement. For this segment of the series, a discussion on anesthesia and the brain. How does anesthesia impact the brain, and why are we concerned about cognitive decline in our patients? To help answer these questions is Dr. T.J. Gann, Professor of Anesthesiology and Distinguished Endowed Chair at Stony Brook University.
So how do we in healthcare embrace change in the perioperative environment? Well, one of the ways that we certainly can embrace change and need to embrace change is this concept of enhanced recovery after surgery. So what is enhanced recovery after surgery? Enhanced recovery after surgery, and many refer to as enhanced recovery or ERAS, perioperative surgical home, that is populated by the American Society of Anesthesiologists, is really a different way to look after our perioperative patients and using evidence-based practice to focus on what are the various elements that are critical to trying to speed up our post-op recovery and replace that with traditional practices, which often over time has become obsolete, and sometimes we still hang on to it. So I think the focus really is to trying to change our way you look after the patient, make it more patient-centered rather than siloed mentality in the old practice, and come together and say, okay, how can we take care of patients who are undergoing a colorectal procedure or urological procedure and take them through the surgical journey and have them recover much quicker, leave the hospital much quicker. And also, more importantly, reduce complication rate, because we know that complications, any surgical complication post-operatively, is the major expenditure that we spend on healthcare. This slide shows you the amount of money that need to be spent when patients develop complications. For example, if you look at the median total hospital costs, whether some patient have complication or not, it varies enormously, regardless of the type of complication. If any time when there's a complications, the average cost of that complication is about $10,000. So if you look at the patient who recovered without complications, the median hospital cost is pretty consistent, sitting around $5,000 per patient. However, once the patient develops complication, that cost goes up many, many times. And in some cases, for example, respiratory complication, the cost escalated tenfold compared to without respiratory complication. So clearly, if you can reduce a surgical complication intra and post-operatively, you stand to gain by reducing large amount of healthcare costs for that particular patient. Now, this gives you the various elements of enhanced recovery after surgery. Essentially, you can divide it into preoperative, intraoperative, and postoperative. And we're not going to go through each of these elements for enhanced recovery, but suffice to say that there are several important elements that we are going to focus on today. For example, within the intraoperative period, we know that fluid management is critical. We know that pain management is critical. we know that neuro monitoring is also an important component of the enhanced recovery process. Post-operatively, I think probably the most important element is to getting the patients up and about as quickly as possible, get the patients to eat and drink as soon as possible so they can have their bowel movement so they can then be discharged from the hospital. And in the pre-operative period, patients' education is going to be key so that they can expect what they will have to go through in the post-operative period.
Please tune in next week for a new segment from this series wherever you find your podcast. This is the Medtronic MedEd Learning Experience. Thank you for listening.